Hi, my name is John Eberhardt. I am a manufacturer rep and a respiratory therapist for International Biophysics, the manufacturer of the AffloVest. Today we're going to be talking a little bit about what to do when you receive your AffloVest. I'm going to go through the AffloVest itself, how it's going to look when it shows up at your house, go through each one of the devices on the vest itself so you know exactly how it works. And then we're going to talk a little bit about setup of the vest and how it should feel and look when you're wearing it during your therapy sessions. So let's get started. So right now, your vest is going to look like this when it shows up at your house. Okay? It will show up in a box with a plastic bag over the carry bag that comes with the device. When you pull the device out, there will be a battery that looks just like this, that's going to be separate, that you'll put in this little pocket, battery pocket, and there will be a digital controller that has some bubble wrap around the digital controller that you'll take off. Once those two procedures are completed, this is what your vest will look like. So it comes completely set up and taken care of and ready for use. So let's talk about the vest itself and exactly how it works, and then we'll set the vest up on you. The AffloVest has 8 motors in it. There's 4 in the front and 4 in the back. These motors are oscillating motors that are going to correlate with each lobe of your lung. And that's why we're going to be able to mobilize the secretions that are creating issues in your lungs, keeping you from breathing very well, keeping you from coughing continuously, keeping you on antibiotics quite frequently with respiratory infections. So that's how the device works with the oscillating motors. It also has different therapy modes that I'll go through in different intensities as well. The battery itself is a 2-hour battery. Once you receive the device, it'll be about half charged, so you'll need to charge it up completely after the first use, or really right when you get the device. If you wanted to plug it in and charge it up the rest of the way, that would probably be the best thing to do. Okay? We're going to go ahead and put the vest on and fit it. I'm going to show you how to fit a vest, and then we'll go through the therapy modes and intensities and go through a typical therapy session for the AffloVest. Vest is very simple to put on. So once we get the vest on, with the 3 buckles, you want to snug the straps up, just so that it's snug enough to not be uncomfortable, but snug enough so that the motors are hitting your lung wall or your chest wall firmly. Okay? And as you use the vest, your level of comfort will change a little bit. Right now this is extremely comfortable. I might be able to cinch it down as I get used to the therapy as the days and weeks go by. Okay? The vest itself has shoulder straps as well. And to set these shoulder straps, the best way to do it is to sit down in a chair and then buckle these shoulder straps down. That way when you do sit down in a chair, if the vest is riding up at all, then you can actually tighten these up, and it will not ride up on you at all. The vest position will remain high enough on your chest so that the lobes of your lungs will be affected appropriately. You don't have to sit down when you do this therapy. That's one of the real benefits of AffloVest therapy, is it's mobile during use. So you can use it while you're gardening, and you can use it while you're doing the dishes or the laundry or taking a walk, or that's one of the big benefits of AffloVest therapy. So set these shoulder straps to a comfortable level for you, and you are fit with the AffloVest. Now let's talk about the therapy itself and how this is going to work. This is a digital controller that comes with the AffloVest. On the digital controller, there is a power button on the top left-hand side. When you press that button and hold it down for 3 seconds, the device will turn on. You'll see the LED light up. On the LED on the left-hand side is the therapy modes, P, V, and D. P stands for percussion, V stands for vibration, and D stands for drainage. On the right-hand side, you'll see high, medium, and low. High correlates with 20 hertz, medium correlates with 13 hertz, and low correlates with 5 hertz. So also on the digital controller, there's a button that says Go on the top left-hand side. This button is a programmable button that is set by the manufacturer, but can be adjusted by your DME provider. So how you're going to use that Go button is when you initially get set up on the vest. Probably the best thing to do until you really know what you like and what works for you is to turn the vest on with the power button and then hit Go. That button will take you through all 3 different therapy modes on medium for about 10 minutes. So each therapy session will be 30 minutes, and that is the goal. We want you to use the device for 30 minutes twice a day, a typical prescription. Sometimes your physician will order it slightly differently, but typically it's 30 minutes twice a day. And then as you improve, you can use it less or more, but judging by your physician's prescription and talking to your physician in the office, okay? The buttons on the bottom here, these are just buttons that take you around the digital controller. On the bottom left-hand side, you'll see a button that says Program. That's how your DME provider is going to set the Go button. And on the bottom right-hand side, you see something that says Usage. That's your hour meter. It's going to be important for you to know how to get into the hour meter so you can read how many hours are on the device, just in case your physician is looking for compliance, how much you're using the device per day, so that they know you are benefiting in using the device. So I'm going to go ahead and turn the vest on so you can hear how it sounds. All right, we're going to start the vest on percussion, on high. Okay, this pause play button at the bottom is how you start the vest. If you want to just use it on its own, if you want to just set your therapy yourself. So you can hear the motors, all 8 motors turning off and on, off and on. This is percussion. This therapy mode is typically used to help secretions move up the airways more readily. Okay? It allows secretions to rest against the lung wall and then be moved forward. Rest against the lung wall and then be moved forward. So it moves secretions pretty well. Okay? Vibration, which is the second therapy mode, has all 8 motors operating at once. Okay? This is a real popular therapy mode. People like this a lot. It really does a good job. This is vibration on high right now. So this is literally as loud as the vest will ever get. If the device is fit to you appropriately, like this one is for me, this is as loud as it gets. You'll hear like you're talking into a fan while you're wearing your vest. Perfectly normal. But it is more aggressive than it sounds because there's all 8 motors, there's 8 waveforms that are really creating turbulence in your lung fields and moving those secretions around. Okay? So that's percussion and vibration. And then drainage. Drainage is a therapy mode that will take secretions from the outside of your lungs or from the far portions of your lungs or the bases of your lungs, and it will move those secretions into the center of your lung field to the larger airways so you can actually cough those secretions out. This is a very important part of afflow vest therapy. Any vest therapy is fantastic as long as you are coughing. Okay? Once the secretions get to an area where you can cough them out, 3 or 4 times during your therapy session, you need to actually take a deep breath and cough. If you need to learn how to do effective techniques for coughing, you can talk to your DME provider, and they will help you learn what to do what's called a huff cough, which is a slightly more effective way of actually getting the secretions up and out. And they can talk to you about that as well. Okay, so those are 3 therapy modes. This being the loudest one. All right, so I'm going to go ahead and turn the device off so I can continue to talk a little bit to you. All right, so the battery on the opposite side, I'm going to go ahead and put the controller back in the pocket here. The battery on the right-hand side is a 2-hour battery. Okay, the charger on the battery here is here at the bottom. Okay, that's the plug-in for the battery, and this is what your charger is going to look like when you pull it out of the bag. Plugs directly into the wall, into a little converter box there, and then plugs directly into the bottom of the battery. Okay, you should charge your vest once a day, once every other day. Because it's a 2-hour battery, it tends to work for at least 2 days. So if you charge it once a day, you will never run out of juice. If you do ever run out of battery, the device will run and charge at the same time. So you can plug it into the wall, sit in a chair, lay in your bed, and actually do your therapy while you're charging the battery at the same times. It sort of takes away some of the benefits of AffloVest therapy, because what we want you to do is, if at all possible, use the device while you're moving around and doing your activities of daily living. Okay? But this gives you the option to use this way, if you need to, if you haven't charged your battery. Simple as that. So, battery controller. The warranty on the device is a 5-year warranty. So if anything happens to your vest while you have it, the manufacturer will cover the device up to 5 years. If anything happens to your vest afterwards, then your DME provider will take care of that for you as well. Okay? So just reach out to your DME provider and they will actually help manage that for you. All right? That is the AffloVest. That's simple as that. Follow your doctor's prescriptions, and we're hoping that you're able to get your lungs a little bit more clear when you're in the need for some airway clearance. Clear your chest with AffloVest. Thanks so much.